Hello friend, today we will be talking about sexually transmitted diseases, that is STDs. Here we will cover all the important points related to STDs with respect to competitive exam like Gpat, NIPER, JEE, drug inspector, pharmacist exam and D pharmacy exit examination. So let's come to the topic. First, what is sexually transmitted diseases? These are the infections transmitted on sexual contact and can be caused by the microorganisms like bacteria, viruses, or parasites. Here we have categorized these STDs or sexually transmitted diseases into three categories. First, diseases which is caused by bacteria, then STDs which is caused by viruses, and third, which is caused by parasites. First, we will see the disease or sexually transmitted disease caused by bacteria, that is gonorrhea. Gonorrhea is a disease caused by Neisseria gonorrhea, and identification test or diagnostic test use is nucleic acid amplification test for diagnosis of gonorrhea disease. Second STD caused by bacteria is syphilis. Syphilis is caused by a spiral-shaped bacteria spirochete known as Treponema pallidum. Treponema pallidum is a causative agent for disease known as syphilis. Syphilis is diagnosed by different diagnostic tests which includes VDRL, that is Venereal Disease Laboratory Venereal Disease Research Laboratory test, Kahn's test, and Weizerman test. Third, bacterial STD includes chlamydia. Chlamydia is caused by Chlamydia trachomatis, and diagnostic test used for chlamydia is ELISA, that is enzyme linked immunosorbent assay, which use the chlamydia antigen as a marker. Next is sexually transmitted disease caused by viruses. First of this category is herpes or herpes. Here R is silent, so pronunciation is herpes. This is caused by herpes simplex virus type 2. There are two HSV, that is herpes simplex viruses, type 1 and type 2. Type 2 is the most common cause or causative agent for herpes disease, which is transmitted on sexual contact and caused by the virus, that is herpes simplex virus type 2. Diagnostic test is PCR and ELISA. PCR stand for polymerase chain reaction and ELISA is used for diagnosis of herpes disease. Next is AIDS, that is acquired immunodeficiency syndrome caused by HIV, human immunodeficiency virus. So here human immunodeficiency virus HIV is the virus which caused the disease known as AIDS. AIDS is the disease caused by HIV. Different diagnostic tests used for identification or screening of AIDS is ELISA, Western blot, PCR, that is polymerase chain reaction, reverse immunoblot assay, Fujirebio agglutination test, and Karpaz test. These are the different tests used for diagnosis or screening of AIDS disease. Next, sexually transmitted disease caused by virus is hepatitis B, which is caused by hepatitis B virus, and diagnosis is done by using test known as ELISA. This ELISA test for hepatitis B uses Hepatitis B surface antigen HBsAg as an marker. Next disease is genital wart. This is caused by human papilloma viruses HPV. If it is not treated early, it may cause the cervical cancer in females. Next sexually transmitted disease is caused by parasite, that is Trichomonas. Trichomonas is caused by Trichomonas vaginalis. Next is lice crabs. This is mainly pubic hairs infection. So we have covered all the sexually transmitted disease and its important points. Here important points are: first you should remember the category, that is which disease is caused by bacteria, which is caused by viruses and which is caused by parasites. In previous year they have asked one question on this category as well. The question was Trichomonas vaginalis is caused by, and option was bacteria, fungi, viruses, and parasites. So correct option will be parasite for that question. Next, you should remember the causative agent for particular disease. So they have asked which is a causative agent for syphilis and gonorrhea. So you should remember the name of causative agent for each disease as well as type of microorganism which is responsible for causing that disease. And next is which diagnostic test used for the diagnosis or screening of that particular disease. That is also important. So they have asked from this which test is used for diagnosis or screening of AIDS disease. So you have to remember type of microorganism causing the sexual transmitted disease, its causative agent name, and diagnostic test used for diagnosis of that particular sexually transmitted diseases. Now we will look at different modes for transmission of HIV in HIV viruses. So first mode is unprotected sexual contact with infected person. Second is this HIV infection can be transmitted from mother to baby either via placenta or through the milk while breastfeeding. Next mode will be transfusion of contaminated blood or blood products, and last will be sharing of needles or blood which is used for infected persons. So we have covered all the important points related to sexually transmitted disease with respect to competitive exams. If you like the video, subscribe the channel and share with your friends. Thank you.